Hello, my name is Dr. Mike Chukwu. I want to welcome you to my broadcast. Please make sure at the end of this broadcast you like, share, comment so that more people will come in and learn from our wealth of experience. God bless you. I want to thank all of you who have been with us in this channel. I want to teach us or explore on fasting and prayer. But let me first of all start with the medical benefit of fasting. Medically speaking, fasting is abstinence from food for at least 8 to 12 hours. During this period, the body undergo a lot of biochemistry. And before I go into the medical and the benefits of fasting, I want to kind of discuss what actually takes place in the body, because we are meant to be feasting and fasting. Unfortunately, many people live their life only on feasting. They eat 3 meals a day constantly. If you live your life on that, you may be suffering the disease of the modern man. So there are a lot of medical benefits of fasting. Now, why is it that people find it difficult to fast? The reason is because of some teachings from the nutritionists. They said you should eat morning food like a king, afternoon food like a prince, and night food like a slave. That means you are obligated to eat 3 times in a day. And if you eat 3 times in a day, you may not be a healthy man. You may not. Don't get me wrong. I'm going to give you the biochemistry behind and the physiology behind all this thing. So why is it that people find it difficult to fast? The reason is because of some reactions that the body undergo during fasting. Number one is hunger. Hunger. Even Jesus, who is our Lord, in the book of Luke chapter 4, if you read verse 1 and 2, the Bible says that he was driven into the wilderness to fast. In those days he fasted, and then it was tempted of the devil, and in those days he fasted, and afterward he was hungry. So many people are not disciplined enough to just endure, and hunger during fasting is as a result of the hunger hormone. There's a hunger hormone we call ghrelin. That ghrelin are occasionally released, and then they will send message to the brain, and the brain will begin to demand. You start having that craving, but it comes and go. That is why if you are doing work and you don't have time to eat, during that hunger, when the ghrelin is released, is high in your body, you will just be feeling as if you don't eat now, you will die. After let's say 30 minutes to 45 minutes, that very hunger will just fizzle out. If they give you food after, they say, I'm not even hungry again. So many people cannot endure within that. The panic will still come back again, constant. So many people cannot endure that. That is why they find it difficult to fast. Another reason why people find it difficult to fast is that during fasting, many people feel dizzy. And that dizziness is as a result of the blood pressure. When you are fasting, the blood pressure tends to be low. And that lowness in blood pressure is because of, that's why you need to take a lot of water when you're fasting. I encourage water fasts more than fasting that does not involve water, because water fast has a lot of health benefits. Another thing that makes people not to fast, is that when they fast, they start having cramps, abdominal cramps. And many people say that abdominal cramps is due to ulcer. I want to disagree with you. The reason why you have abdominal cramps is because of what we call electrolyte derangement. Even as a little child, when we were in the village, in those days when you are having serious cramps, our mother will say, go and put small salt in water and drink. And surprisingly, when you put the water and salt and drink, the abdominal cramps will cease. So it is the same thing. If you are fasting and you're having cramps, abdominal cramps, just put a little salt in water, not just a little salt, to correct that sodium derangement and some other minerals that are deranged. If you just put that in the water and drink, that cramps will stop. Another thing that makes people not to fast is weakness. Because of the biochemistry that take place in the body, you are having some weakness, when you are fasting. However, there are millions and one benefits of fasting. Let's look at how the human body handle food. Let's look at how human body handle food. Because when I start talking about the health benefit of fasting, I will be making references on this now. I want to discuss now. I will be making references on them. Okay, so how do human body handle food? See, when you eat food, most of the food we eat are full of carbohydrates. There are two primary sources of energy for human body. Number one is glucose or sugar. Let's use word sugar, the one that you understand. Sugar is the when you eat food, the last product of carbohydrates is sugar. So when the body, it is like the current account where the body can just go into and collect energy immediately. So when that carbohydrate in your body, which is the primary source of energy, with the money, the account that you have that you can spend from easily. Let's use bank account as an example. That is where you go and collect. When your body needs energy, quick energy, you will go to that. They go to sugar or to glucose and collect the energy. Now, when the energy that you eat is more than enough that your body can use at a time, the body will begin to convert that energy into what we call glycogen. And then it will store that glycogen in the liver and in the muscle. About 1/3 is in the liver, then 2/3 are in the muscle. You will go and store it there, the glycogens. So that when you are not eating, the body will now refer back to that glycogen and convert it back to the glucose and use it. Okay? But the sugar itself, which is the glucose, they are not really a pure source of energy. There's another source of energy that the body uses called ketone. Ketone are like when the body stores the food as glycogen, then there will be some leftover. Then the body will begin to convert that one into fats and store them in fatty tissues. We call it in medicine triglyceride. Some protein that you ate that your body cannot use at that time, some fatty food that your body cannot use that time, some glucose that the body cannot use that time. The body will convert it into savings account you cannot touch, and then go and put it as fat in the tissue. You will gather it up and make a food called triglyceride, and that triglyceride the body will take it and go and put it in the adipose tissue, that is in the fat, and then the person will start developing some fat, especially in the belly fat. So these things are important. I want you to get this initial part, because if you get it, when I start talking about the medical benefit of fasting, you will need this primary understanding. So when the body stores this food as fat, anytime the body is in need of food, when you are not eating for the first 12 hours, what the body will do is that the body will now go to the glycogen first, and then begin to collect from glycogens and be converting them to glucose. When the glycogens has finished, which normally happen within the first 12 hours of you not eating, then the body will now go back to that fat that it stores and convert them to ketone, and then use the ketone as a primary source of energy. And the ketones has a lot of good benefits. So anybody who eats often, the fuel in which he runs his body with is glucose, either glucose or glycogen that come back to glucose. But those who fast, who eat and fast, they eat and they fast, the body will be switching from sometimes you use glucose, sometimes you use ketone. And the ketone is a better fuel to the body. There are so many advantages that the ketone can do to your body above glucose. Now, let's look at it this way. When you eat your food, there is a part of the body called pancreas. That pancreas will release insulin. It is the job of insulin to convert the glucose that your body has into glycogen. So this insulin that is in your body also will supposed to go up and come down The insulin will go up and it will come down within the space of 3 hours. Now, when the insulin continues to be high in your body, the insulin have a lot of side effects. The body does not want the insulin to be high always. In as much as also the body does not want the glucose to be also high always. When the glucose is high in the human body, we call it hyperglycemia. So if you have hyperglycemia, you attract the body to release insulin, and the job of insulin is to help your body use some glucose to produce energy. The one that is in excess, the insulin will help it to convert to glycogen, store in the liver, some will store it in the muscle. Then, if it is still so much, the insulin will also assist in the conversion of some of the glucose into triglycerides that is stored as fat. Okay? But, hyperinsulin, when the insulin is high in your body, there are many things the hyperinsulin will cause. Number one thing that hyperinsulin will cause, that it will make your body not to be sensitive to insulin again, because the body is always, when something is always high in your body, you are a man that drink alcohol. Let me use an example. You drink alcohol every day. As you keep drinking alcohol, the time will come, one bottle will not be enough for you again. You need to drink two for you to feel the same way you feel. So constant high insulin will lead to low insulin sensitivity. Your cells will not be sensitive to insulin again. The cells that are so, and that is what normally leads people to type 2 diabetes or pre-diabetic. And sometimes that high insulin in the body has a way of affecting the blood vessels. It will destroy the lining of the blood vessels, making many people to have hypertension. So we don't want the insulin to be high in the body always. The insulin should just be high, help to do few works, return back to normal. So it's like people that are suffering from hypertension, if you check their insulin level, even though they are not diabetic per se, but they have hyperinsulinemia, that is high insulin in the blood. The insulin itself will destroy the lining of the blood vessels. And then sometimes it will deplete a chemical in the body called nitric oxide. This nitric oxide is what helps the body to, the blood vessels to exhibit elasticity. That is, it will keep expanding, what we call vasodilation. It will dilate and constrict and dilate. It is the nitric oxide that assists the blood vessels. So, but hyperinsulin or hyperinsulinemia, that is hyperinsulin in the blood, depletes nitric oxide and then prevent vasodilation. So that is what normally leads many people to hypertension. And even in the heart muscle, the hyperinsulin affect the heart muscle, especially the left ventricle. I will try as much as I can not to use so many medical terms so that you understand what I'm saying. Okay, so the heart has chambers. We have the part we call the ventricles, or the part called the atrium. But the part that insulin affects most is the left ventricle. And the left ventricle is the part of the heart that actually pumps blood and distributes the body. So it will go and cause the hypertrophy, that is the thickening of the muscle of the left ventricle, and then lead to even heart disease, heart failure, lead to hypertension, congestive heart failure, and heart diseases, atherosclerosis. Atherosclerosis is when the arteries are being congested. Hyperinsulin lead to plaque formation. Plaques are like, what pimple is to the face is what plaque is to the blood vessel. That pimple that appear on people's face can appear inside the blood vessel. We call it plaques. And it is that plaques that forms, the plaque form as a result of the response, the lining of the blood vessel responding to hyperinsulin or hyperinsulinemia. And hyperinsulinemia can lead to hormonal imbalance, especially in women. It causes the ovary to secrete male hormone called androgens. Male hormone called androgens, and prevent ovulation. So many women that are pre-diabetic, they're not even diabetic, but they are battling with hormonal imbalance. That hormonal imbalance, if you check their insulin level, you now discover that even though they are not diabetic, but they are having hyperinsulin. And that hyperinsulin will have negative effect and prevent their ovaries from releasing. It makes the progesterone estrogen ratio, which is supposed to be at the balance level, it will alter that balance. And when once that ratio is not balanced, the woman will not be able to ovulate. Then hyperinsulin can also lead to what we call fatty liver. It makes the liver not to function well. You see, so the hallmark of the food you eat is so that the food will provide energy, then the energy will be used. But if you don't regulate the way you eat it through fasting, we are coming to spiritual benefit of fasting. I'm still talking about the medical ones. If you don't regulate the way you eat the food, even though the food was meant to provide energy in your body, then the food may likely lead you, to have hyperinsulin. And then the hyperinsulin will bring all this trouble that we are talking about. So now, what happened when you fast? What happened when you fast? We call morning food breakfast. Morning food, we call it breakfast because it's supposed to be at least 8 hours after you have finished. Whether you eat your night food for you to now eat your morning food. We call it breakfast. I want us to look at what happened. I said that fasting occurs between when you have not eaten food for at least 8 hours. Especially at night when you sleep, you eat by 8 o'clock, 9, 10, 11, 12. That is 4 hours plus 6 hours. By 6 in the morning, you're already about 8 to 10 hours. So if you eat morning food, we call it breakfast. So, but within the first 12 hours when you have not eaten, the body must have used the food you ate and then deplete the glycogen storage in the liver and in the muscle. Then, if you don't eat again, you did not eat, the body will now begin to look for other sources of energy after 12 hours that you did not eat. And one of the places that the body will go to is that the body will now go to the fat storage, and begin to convert that fat storage into ketones. So that's why I said that the two primary energy sources in the body is glucose and the ketones. That's the two primary ones. But the body can make other things and help itself. But these two are so. And once the body begins to make ketones after the 12 hours, then the ketones have a lot of advantages. The ketone is a better fuel for body. The ketone is a signaling molecules. What I mean by that is that ketones can stimulate the body to produce many things. Let me give you an example of one of the things that ketone does. At 17 hours that you have not eaten, the ketones will stimulate the body to begin to produce what we call growth hormones. Growth hormones. It will go to the brain and stimulate the body to produce growth hormones. And these growth hormones, when you are smaller, your body produces a lot of growth hormones. It is this growth hormone that help you to grow and make you to look younger. So, but if you fast, your body, till about 17 hours, if you have not eaten, your body will not stimulate the brain, the part of the head called pituitary gland. It will double the production of growth hormones. And this growth hormone that the body will produce, it has a lot of advantages. In fact, there's a study that says that the body can even produce up to 5 times the normal growth. Everybody produces growth hormone, but the person that fasts produces more of it. If you strike up to 17 hours of fasting, from that time upward, the body will begin to produce that growth hormone. Do you know how much growth hormone is cost, the artificial ones in the market? The one that you can take that will carry you for 1 month is more than 400, between 400 to 1.5 million, depending on the company that produces it. But your body will produce it free of charge. And these growth hormones will help your tissues to repair. These growth hormones will signal your body, make you feel younger, make you feel fresher, make you feel better. During that time, the body, there's what we call autophagy. Autophagy literally means body eating itself. Don't get me wrong, it's not that your body is eating itself, but what the body will do during that time, the body will start looking for any source of energy. One of the things the body will do is that the body will go to the old cells. There are some of your cells that are old. There are some of the cells that are cancerous, that want to become cancerous. They are no longer normal. The body will go into those cells and demand that all the old organelles will die. So the body will destroy those dead old organelles, remove correct energy from there, and use to make fuel for himself. Then, after some time, your body will not generate new ones. So within that period of your fasting, your body will take that opportunity to renew itself, take off all the old cells, and then produce new ones. So if you understand this scenario, this thing that I said now, we now begin to look at the medical benefits. The medical benefits of fasting. Number one is that fasting helps to treat rheumatoid arthritis. Rheumatoid arthritis. Arthritis is an inflammatory disorder. That is, the body is, allowing some cells to swell up and then gather some cytokines, some inflammatory cells, But when you start fasting, the body, and these inflammatory cells uses majorly sugar. Even cancer cells, they use majorly sugar. So, but when you start fasting, you deny those cells, those inflammatory cells, they eat primary source of energy. Ketones are not primary source of energy, so they will begin to shrink down. The joint pains will begin to go. Some other inflammatory disorders will begin to go. Another thing that fasting is a treatment for type 2 diabetic. Because when your sugar level is down constantly, the insulin that used to be high in the diabetic patient, the insulin that used to be high in type 2 diabetes will drop down. Then the sensitivity of insulin will now begin to show in the surface of the receptors. So with this, the type 2 diabetic who engage in themselves in consistent fasting, may find themselves treated. Fasting is used in treatment of hypertension, high BP that you know. Because hyperinsulin, as I said before, destroy nitric oxide. So when you bring your insulin down, nitric oxide will be preserved. Then the blood vessels will return back to their normal elasticity, and then your blood pressure will return to normal. So when you fast, the blood pressure can come down. And also, during fasting, some of the bad cholesterol, we call it low density lipoproteins. The low density lipoproteins are the bad cholesterols. But when you fast, those bad cholesterols quantity in your blood will drop. While the good ones called the high density lipoprotein will increase. With this, your blood pressure will normalize. Also, fasting improve gut health. That is the health of your intestine. I used to see people when they eat, they say the reason why they eat every time is because they are having ulcer. So it's because they are having ulcer, that is why they eat 6 times in a day. If you eat that way, you can never be okay. You can never be well, because it is not the treatment of your gut need to rest to be able to repair. If that ulcer must go, you need to fast, even in the midst of ulcer. Yes. It may sound contradictory, but it is true. The resting of the gut is what gives the gut the opportunity to repair. There are about 100 trillion microbacteria in human gut. Out of these 100 trillions, there are some that are bad ones, there are some that are good ones. The bad ones depend solely on sugar. So anytime you deny the body food for some time, the bad ones will die off. The good ones will begin to grow more. And it will help to repair some of what we call leaky gut. That is some of the breakage in the lining of your intestines. This thing occurs during the time you are fasting. Your intestines will take time to heal. And all the places that the intestine has on those leakages, it will seal up during the time, because you are resting the gut. But if you are the type that in the morning you eat rice, afternoon you eat beans. Night, you eat a swallow. Then sometime in the midnight, you take some teas. Or if you're not taking teas, you eat some fruit and vegetables. You keep the gut working 24 hours. That gut will not have time to heal. That gut will not have time to heal. Now, fasting improves your immunity. Fasting improve your immune systems. Your immune systems. During fasting, there is what we call stem cells. Stem cells are formed in the bone marrow. That is what gives birth to all other cells in the body. It is the stem cells. We call them progenitor cells. These stem cells are stimulated to be produced when you are fasting, especially the ones that form the white blood cells. The white blood cells are what is responsible for body immunity. That's what makes your body to fight against diseases. So we can indirectly say that fasting can be used to treat infection, because when you improve the quantity of your white blood cells, it will knock off every infections in the body. So stem cells productions during fasting is highly improved. Then autoimmune diseases, some autoimmune diseases, that is immune diseases that are, your body is reacting against itself, are also taken care of, during fasting, because those cells will not be able to react more, or the body reacting against the environment. They will not be able to react more against themselves, because there are a lot of deniers that take place. That is, the inflammatory cells that cause them to react are highly denied. Now, during fasting, number 6 is that during fasting, fasting help you to detoxification, because it promotes the health of liver. Remember that during fasting, the body will first of all report to the liver and take away the glycogens that are there, and convert it back to glucose. If that one finishes, the body will go back to the liver and tell the liver, I need more energy, I don't have energy again, help me. Then the liver will now begin to produce ketones through the fat. So, and the fat that are stored in the liver, that makes many people to have non-alcoholic fatty liver, which is the disease condition. Non-alcoholic fatty liver. The body will now refer back to that fat, the fat in the liver, and then begin to collect those fat to make energy. And the energy source that the body makes from that is called ketones. And ketones are very, very, very good in the body, because ketones are one of the molecules that help to stimulate growth hormones. It's one of the molecules that stimulate the brain. I'm coming to that. So also, fasting helps you to stay younger. If you are the type that have fasted before, maybe you have a bulky body and all that, and you take time to fast. When people see you, they will start telling you, you're looking younger. They are not, what they're saying is not wrong. What they're saying is the truth. The reason why you are looking younger is that during that time you are fasting, all the old cells, the body will demand from them and take out all the organelles of the cells that are old and replace them with new ones, because the body is looking for food. And because it's looking for food, the place it's going to refer to is some of the body cells that are already old, or cells organelles that are already old. It will take the opportunity and renew them, and then come back again as a fresh body. So also autophagy, just like I said before, is high during that time. That is the body trying to eat itself and then bring out new cells. Then fasting also activates longevity genes. The genes that make you to live longer, it is activated when you are fasting. That's our forefathers, people that don't have they don't have the kind of food we have. They can go for days hunting for meat, and they finally hunt for the meat. They will get the meat, they will cook it, and they will eat. They may eat once in a day, and they are fine. That's why they were living 120 years. But because agriculture has so much modernized, such that a modern man can do hand like this and he will see food and eat, our system lost that longevity gene. But if you live your life, alternate your life with fasting and feasting, as I said at the introduction time, you are going to live longer. It activates longevity gene. Now, it also enhances mental clarity. Mental clarity. During fasting, the ketones, which is the primary source of energy during fasting, not glucose, we go to the brain and stimulate the brain to produce what we call DNF, brain drive neurotrophic factor. That's the meaning of BND. This brain drive neurotrophic factor will help the brain to produce new cells. It will help for generation of new synapses. That is, the brain will begin to produce new neurons that will help you to become more clear, make things because ketones is a better fuel to the brain than glucose. It's a better fuel. So mental clarity, if you are fasting at the earlier stage when you are still feeling dizzy, you have not entered into ketogenesis. You have not entered into when the body will begin to produce ketones. But once the body begins to produce ketones, you have mental clarity. Now, even for old age, there's what we call dementia. Dementia is loss of memory that we call majorly with old people. An old person that lives his or her life in fasting will not experience dementia because of the ketones we keep the brain active, producing brain drive neurotrophic factor. It will come, and then during fasting also the body produces a hormone called norepinephrine. Norepinephrine. This norepinephrine is a neurotransmitter which helps to improve to help you to become more alert, more aware. All these are what occur during fasting. Number 9, fasting help in the treatment of cancer. Did you hear that? Yes. Treatment of cancer. The primary source of energy for cancer cell is glucose. So when you deny those cancer cell glucose, the rate of their proliferation will drop. It will drop. And if the body enter autophagy, one of the cells the body will target will be cancer cells. That is, autophagy is when the body begin to look at itself and begin to chop itself to produce energy. So the first target will be the cancer cells. They will go there and begin to destroy them because they have some proteins at their surface of those cancer cells that shows that they are no longer healthy. So the body will go there and take out the cancer cells. And then studies have shown that patients that fasted for 72 hours without food, they take only water before they commence chemotherapy. Chemotherapy are the drug used in treatment of cancer. If they fast for 72 hours before they commence chemotherapy, they usually do better. The reason is that within that 72 hours, the body have entered autophagy. The ketones is now the primary source of energy. The cancer cells have been denied of glucose. So they are at weaker states. Then you now hit them with chemotherapy, they will just die off. They will die off. So fasting can be used in the treatment of cancer. Now, fasting improves wound healing. Wound healing. You see, human body has a way to respond when you are sick. Yes. When you are sick, one of the things that happen to you is that you will lose appetite. That loss of appetite that you have when you are sick is not abnormal. That loss of appetite is that the body wants to deny itself some glucose so that it can be able to heal. Even animal, when animal is sick, maybe dog, some of these animals, they will stop eating. They will rather go around, maybe look for herbs and begin to chew it. Animal that is not herbicide. If you put them normal food, they will not eat. This is their body responding to denying the body glucose so that they will receive healing. But you see some people say, since one day and that, this child have not eaten. That child is not eating. It is not bad for that child. It can only become bad when that not eating becomes so protracted, maybe for 2 weeks or thereabout. But if it's just what happened in 2 or 3 days or 4 days, you shouldn't bother yourself. That thing that happened is actually good for the body. The body is responding to that. The body wants to deny itself food to stimulate immune system. When that body denies itself that food, you will start feeling nauseated. You don't want to eat anything. Your body doesn't want anything that is called food. Your body will reject it. That body is rejecting that food at that time so that the immune system will be stimulated. Because once you deny the body glucose for some time, it will signal to the white blood cells and the immune will come up. And then wound healing, and then it will also signal to the growth hormones, which is the hormone that is responsible to cause repair of damaged tissues. Okay, the damaged tissue that occur, in somebody that has wound and all those things, it will signal to that growth hormones. The hormone will be reached out into the body system, and that wound healing will take place faster. All right. Fasting also help what we call metabolic flexibility. Let me explain what I mean by that. 80% of people you see on earth depend on glucose. They never go into their savings account, which is ketones. They never go there. They eat, the body will take it within 12 hours, they have eaten again. Within another 7 or 8 hours, they have eaten again. So the body keeps switching from glucose, then glycogen, bring it back to glucose, then glycogen, then bring it back to glucose. But the body is meant to use glucose and glycogen, then after some time it will go to the ketone, which is a good fuel for the body, and clean up itself. Now, any man that fasts, your body will learn how to adapt between using glucose and using glycogen. We call that state metabolic flexibility. It will help you to adapt. It will help your body to be very, very flexible. It will help the flexibility I'm talking about is not for you to shade. It will help your body it will help you to survive long time and help you to live longer. So metabolic flexibility is an advantage for those who fast, because the body knows how to switch to another source of energy, which is the ketones. The body knows how to switch to it. Number 11 or number 10, number 12, sorry. During fasting, you have what we call weight loss. Weight loss. Now, those who come from fat families like mine, you may fast and your body will reduce physically, but when you stand on the weight, your weight will remain the same. Your weight will remain the same because the first loss of weight, the first loss that the body experiences is not from the fat. The body will first of all go to glycogens, collect the glycogens, and the glycogens are usually bind to water. So it's from the loss of glycogens and the dehydration that make you that form the initial reduction in your body. Why insulin will go and lock up, it will go and lock up the fatty store and make sure that it does not come out. When once insulin is high in your body, the fat cannot be released. So the body will begin to battle until the insulin go down. When the insulin, if you endure long enough, not 1 day or 2 days fasting, no. I'm talking about something that lasts long enough. If you endure long enough, the body will now begin to knock at the door of ketones and say, it's time, we have finished all the glycogen storage. You need to give us some fats. Let the fat begin to break down. Then the fat will begin to break down. When once you reach to that level where fat begin to break down, you begin to lose weight. So the loss of weight at that time is not muscle based. You're not losing muscle. It is fat based. It's fat based. It is the fat that is being broken. The fat. Your muscles are intact. Your muscles are okay. So, but the fat will not be so. You now have what we call shedding of weight. So, if you want to lose weight, you can take a time to fast. We're talking about medical benefit of fasting. Then number 13, there are many other ones. Fasting is used in treatment of infertility. Infertility. If you fast, especially those who have hormonal imbalance, hormonal imbalance is caused by hyperinsulinemia. That is the insulin that is too high in your blood, and this insulin too high will stimulate your ovary to produce androgens. It will also alter to go to the pituitary gland and alter the progesterone estrogen ratio and destabilize the balance that the nature has put. If you are the type that drink Coke, drink Fanta, drink malt occasionally, not occasionally, that is, you drink them always. If you are not eating biscuits, you are taking some snacks, your body is always taking in something every 2 hours. You are most likely to have hormonal imbalance. And if you have that hormonal imbalance, you have what we call an ovulatory cycle. You will see your menses, you will see signs of ovulation, but you will not ovulate. And most women, their tubes are open, their womb is good, their husband's sperm is okay, but yet they cannot get pregnant. They cannot get pregnant because of hormonal imbalance. They are seeing menses, but seeing signs of ovulation, but they are not ovulating. So if you must get rid of that, you must find a way to fast. And the fasting I'm talking about, or you do what we call intermittent fasting, restricted feeding. What we advise people to do, what I do currently is to tell people, just carve out 6 to 8 hours in a day where you eat all your food. Very simple. Carve out 6 to 8 hours in a day. Within that 6 to 8 hours, everything you want to eat, you eat it. After that 6 to 8 hours, you are not eating again. Even if you're hungry, drink water. Do it for 2 months. All these things, you now begin to see the signs. Some of the things that you are having will begin to resolve. As a Christian, when you are doing that, you're not just keeping yourself away from food. You need to bring in some spiritual part of it by engaging in prayers. You see, that's when fasting and prayer now comes in. So if you carve out, for instance, I advise people just skip morning meal. Don't eat morning food. Skip it. Don't eat morning food. If you don't eat morning food, let's say your breakfast is by 12 o'clock. By 6, eat your dinner, and that's all for the day. By 6 o'clock. If you like, eat by 12. By 3, eat again. By 4, eat again. By 5, eat again. But by 6, from 6 upward, don't eat again. So within all the ones you eat within that time, highest by 11 or 12 in the night, the insulin level has come down. When that insulin level comes down, the body will now go to the glycogens and begin to collect the storage. Maybe from that time you stop eating by 6, 12 hours time will be by 6 a.m. in the morning. Your body have used up all the stored glycogens. The body will switch to ketones. It will switch to ketones and then begin to use ketones. As using ketone, from that 6 in the morning till 12, when you're going to eat another food again, your body is running on your savings account, which is the ketone. You will be collecting from there, and then once that ketone is released, many things will start working in your body. The ketones will go to your brain and release growth hormones. The ketones will go to the correct all those anomalies that I'm talking about, and then it will now help your blood vessels to recover if you're having hypertension and all that is. Okay, I will still come to the spiritual benefit of fasting, but these medical ones will help you to be alive first. So even if you are not a spiritualist, you are not a spiritual person, you are not a Christian, but you have some health condition. The way out is to fast. Do restricted feeding. 3 square meal is a scam. You hear that? It's a scam. If you are still living with 3 square meal, prepare to have diseases of the modern man. I'm still coming to the kind of food that you should eat. In fact, I advised somebody, I said, if you fast and you eat healthy food and you exercise, you will live long. If you fast, you eat healthy food. That is when you want to eat. You eat healthy food, and you exercise, you will live long. You will not be a candidate of hospital. You will not be running from place to place. Even when you're already the candidate of hospital, your body will start returning back to normal. Don't believe this issue of 3 square meal a day. Don't believe it. Those who want to live long, they don't eat 3 square meal a day. If you eat 3 square meal a day, especially this kind of food that we eat in Africa that does not have fiber, we are now suffering the disease of the white men, which our forefathers did not suffer. Cancer is multiplying at a higher rate. In fact, the World Health Organization said that in the year 2050, that half of the world population will be diabetic. Half. In the year 2050. The rate at which type 2 diabetes are multiplying, and it is because of the hyperinsulin, due to we are eating food that does not have fiber. You know, your child, you go and sell rice. Your rice, you produce the rice by yourself, you sell it, then you will go and buy your indomie or your yam, you go and sell it. That still have natural fiber. You cut your vegetables that you're supposed to eat, you can go and buy tin tomato. Some of all these alterations in the food that our body is used to is what is bringing plenty of the sickness. So eat well, fast, and exercise. See you in the next class. God bless you.